Are you ready to explore the dynamic relationship between research and evidence-based practice? This video delves into how these elements come together to enhance healthcare. Discover the synergy that ensures effective, ethical, and personalized care.
Evidence-based practice, or EBP, is a decision-making approach that combines the best research evidence with clinical expertise and patient values. It ensures that healthcare decisions are not based solely on tradition or opinion. EBP integrates reliable studies, professional judgment, and individual preferences. This approach makes care effective, ethical, and personalized. Understanding EBP is essential for modern healthcare. Research is the foundation of evidence-based practice. It provides the evidence needed to test treatments, identify best practices, and inform guidelines. Without research, decision-making would rely on anecdote or opinion. Research ensures that healthcare is both effective and ethical. It is crucial for advancing medical knowledge and practice. Clinical expertise, patient values, and research evidence come together in practice. A nurse may use research to choose the best pain relief methods. Patient preferences guide the selection of non-invasive treatments. Research-backed guidelines ensure interventions are effective. This integration is vital for managing conditions like type 2 diabetes. It ensures care is tailored and effective. Linking research with EBP improves care quality. It ensures treatments are safe, effective, and current. Consistency in practice is achieved by following evidence-based guidelines. Patient involvement in decisions increases satisfaction and compliance. This connection supports policymaking and funding decisions. Not all professionals have time or resources to access research. Conflicting findings can create uncertainty in practice. Patient preferences may not align with evidence. Translating research into practice faces system-level barriers. These challenges require careful navigation by healthcare professionals. Research is the backbone of evidence-based practice. It provides knowledge about what works and under what conditions. Clinical guidelines rely on systematic reviews and meta-analyses. Without research, EBP would fall into anecdotal decision-making. Randomized controlled trials offer a robust evidence base for practice. Expertise bridges the gap between research and individual care. Patient beliefs and preferences are crucial in EBP. Research evidence is adapted in dialogue with patients. For instance, if a patient is uncomfortable with a device, alternatives are explored. This ensures that care respects patient values while being guided by evidence. It enhances compliance and satisfaction. Combining research, expertise, and values improves care quality. It ensures interventions are safe and effective. Research-informed guidelines reduce care variation. Aligning evidence with patient values boosts compliance. This relationship also influences healthcare policy and funding decisions. Bridging this gap requires professional judgment. Studies often occur in controlled environments, but real-world care is complex. Conflicting evidence can make decisions challenging. Patient autonomy adds another layer of complexity. Implementation barriers may prevent research from being applied effectively. 02, 03, 04, 05. The relationship between research and EBP is dynamic. Research generates knowledge, but it must be interpreted by professionals. EBP depends on research for legitimacy and practice to validate findings. This interdependence ensures care is effective and patient-centered. It requires continuous adaptation and negotiation. The Cochrane Review on Hand Hygiene Interventions is a key study. It assessed interventions like training and policy changes. The review's findings shaped guidelines and improved infection control. It highlights how research informs practice and policy. This evaluation underscores the importance of systematic evidence. The Cochrane Review used a systematic review of multiple studies. It included studies from various countries, providing a large evidence base. Methods like education and feedback were analyzed. The review's strengths include its reliability and clear criteria. Limitations involve study variations and short-term focus. Ethical approval was essential for the studies in the Cochrane Review. Patient safety and staff compliance were key concerns. Confidentiality and informed consent were addressed. These considerations ensure research is conducted responsibly. Ethics play a crucial role in healthcare research. The review found that education and reminders improved hand hygiene. Multifaceted interventions were more effective than single methods. Improved hygiene was linked to reduced infections. These findings have practical implications for healthcare settings. They demonstrate the power of research in enhancing care. The Cochrane Review's findings directly shaped NICE guidelines. It informs infection control training and monitoring systems. The review protects patients and reduces healthcare costs. It underscores the role of research in health and social care management. Such findings are crucial for policy and practice. Cochrane reviews are highly credible and widely respected. The review's evidence is generalizable across settings. It has clear links to practice, policy, and training. However, study heterogeneity and short-term focus are limitations. Limited evidence from low-income countries affects global applicability. Evidence transforms decision-making into a transparent process. EBP combines research evidence, clinical expertise, and patient values. It establishes effective interventions and ensures personalized care. Clinicians tailor treatments to individual needs. Patient preferences guide the final care choices. This integration is key to effective healthcare delivery. Conflicting evidence can make decision-making complex. Contextual barriers may restrict the application of evidence. Patient autonomy requires balancing choice with best outcomes. Decision-making must adapt evidence to real-world conditions. Flexibility is essential for effective healthcare practice.
In conclusion, through the synergy of research and evidence-based practice, healthcare decisions become both effective and ethical. This partnership ensures care is safe, patient-centered, and guided by robust evidence. By understanding this relationship, healthcare professionals are better equipped to overcome challenges and improve patient outcomes. Thank you for watching this video. If you have any questions, please feel free to contact us on WhatsApp at 07484361688.